It's very refreshing. So guys, today's sponsorship is sponsored by Nebula 9, made with real vodka and real fruit. Okay, this is amazing. It is an amazing summertime drink. You guys must try it. Pop it in your cooler, pop it in the freezer, whatever you need to do. It's the best when it's chilled, okay? So definitely try it at your closest liquor store. It's amazing. All right. Bye. What's going on, everyone? We are back again for another episode of the Student to Life podcast, where learning and unlearning has no limits. I am your host, Shan, with my co-host,
Stretch.
And today, guys, we have an amazing episode, like always, with Dr. Craig James, who is a chiropractor. How are you doing today, Mr. James?
I'm doing great. I'm glad to be here, and it's nice to meet you guys.
Awesome sauce. So when we start our episode, we typically ask our guests the same question, which is, what does student to life mean to you?
When you hear the word, the first time you hear the word student to life, what came to mind?
The first thing that comes to mind to me is that we're always learning. So, through this journey of life, we're all the students. None of us know all the answers, and we always have to be willing to learn and be coachable in order to improve ourselves. Mm-hmm. And that's, to me, the definition of being a student of life.
So tell us a little bit about Craig James before the doctor got added to that. A little bit before you became the chiropractor, Dr. James. Who were you before that?
Before that, I grew up in a small town called Florence, South Carolina. Mm-hmm. I was always into sports. I played American football, basketball, track, but I was really good at football. Mm-hmm. I was a quarterback, and I was pretty good at it. I turned out to be one of the top quarterbacks in the state of South Carolina when I played, mm-hmm. and I eventually earned a scholarship to South Carolina State University.
Okay.
And I went to South Carolina State, played ball, graduated. After that, I worked for about 5 years. I worked for a lab company called American Red Cross, the National Testing Lab. Worked there for a few years and decided to go back to school to become a chiropractor.
Mm-hmm. What sparked that idea to say, okay, this is what I want to do?
It actually happened for me. I was around the age, I think it was around 13 or 12. And we had a chiropractor that was doing the team physicals for the football team. Mm-hmm. And I was asking him, what kind of doctor he was. He explained it to me. And I was like, oh, that's interesting. So I actually asked him, could I shadow him for a day, at his office. Mm-hmm. He let me come to the office. I watched what he did. I was like, man, I think I want to do this.
Right. So why didn't you do it in college, that first initial stage in college when you got that scholarship? Like you said, you had to go back to school, right?
Well, when I was in college, I ended up having a son. My son was born. Mm-hmm. So I wanted to, work and earn a little bit of money. Mm-hmm. So that's why I didn't go to chiropractic school immediately after graduating.
Oh, so that was always the plan?
Yeah, that was always my plan.
Okay.
When I was 13, I said I wanted to do this. So that was my plan.
Okay, so because of everything that happened, it kind of just deterred you a little bit what you just initially.
Yeah, because what happened, it kind of slowed down the process, but I stayed focused on it. Mm-hmm. And when I graduated, undergraduate, worked for the American Red Cross for 5 years, saved up some money. When the opportunity came for me to go back to school, I took it.
Okay, that sounds legit.
So for our guests that's not as educated to know what a chiropractor is, can you tell us exactly what a chiropractor does?
Okay, so basically as chiropractors, what we work with is basically the spine and the nervous system, okay? Mm-hmm. Now, the spine supports the frame of the human body, and it protects the nerves. And the brain, which is part of the nervous system, basically controls the healing of the body. And the way it does that is by sending healing information down the spine to your neck, shoulders, mid-back, low back, even down the arms, hands, mm-hmm. even down to your legs. Mm-hmm. And it also sends healing information to your internal organs. Mm-hmm. So as long as the spine is in the correct position, that's when your body's health is at its best. Mm-hmm. But we all go through stresses in life, like injuries from a auto accident, mm-hmm. a slip and fall, work injuries, sports injuries, even things we do repetitively every day, mm-hmm. like wearing our bag on one shoulder, or holding your head down in the forward position. Mm-hmm. While we watch TikTok videos or YouTube videos on the phone, or somebody might be watching this podcast. Mm-hmm. But, those types of things can cause the bones of the spine to move out of place.
Right.
And the term we use to describe that is called a vertebral subluxation. It's very similar to a dislocation, like when you dislocate your shoulder. But the spine only slightly misaligns. But just because it's a slight misalignment does not mean it's a slight problem.
Right.
Because that can shut down the healing information that the brain is sending to local areas like your neck, shoulders, your mid-back, low back. It can even spread to the head, causing headaches.
Right.
It can go down your arms, hands, causing issues like weakness, coldness, tingling, numbness down those areas. It can even send, issues down the leg, causing sciatica. And we also can't forget about the internal organs. For an example, the nerves in your low back, they go to your bowel, bladder, and sex organs. So
if your back ain't good, then it affects everything.
Exactly. So it's within reason to think if you have any misalignments in the low back, you may have issues like IBS, you may have gas, constipation, diarrhea, even urinary issues. It can cause increase of frequency of urination. It can cause issues to the reproductive organs. And also the nerves in the mid-back, they go to the stomach. So if you have any issues there, you could have issues with acid reflux, heartburn, indigestion. The nerves in the lower part of the neck can cause issues with heart and lungs. And the nerves in your upper neck area, they can cause issues with head, nose, and throat or sinus issues. Now, I'm not saying chiropractic care can cure all those things, but chiropractic care can allow your body to heal itself.
Okay.
And as chiropractors, we locate and we detect these nerve pressures and these spinal misalignments, and we remove these nerve pressures and these spinal misalignments. Now, the only way you know if you have these, is to be checked and evaluated by a chiropractor, even if you don't have pain. The most common mistake that people make is they associate their health with pain. But in reality, 90% of the nerves coming from the spine, they don't tell your body about pain.
Okay.
So you could have issues there and not even know it.
Yeah.
So to basically sum it up, if you have a spine, which we all do, you should be evaluated and checked by a chiropractor and be seeing a chiropractor on a regular basis.
Right.
Okay,
I have a question.
Go ahead. Right.
I have a question. So do you think that women should get chiropractic therapy after labor?
Oh yeah, I definitely think they do.
Because that's not talked about. And when you when you said constipation and all those other things, you think because when a woman's pregnant, our organs get shifted up. Our back hurts the bigger we get because we're bringing a whole human. And after you have a child, I want to say maybe like 80 to 90% of women experience back pain during and after pregnancy. So no one talks about the importance of actually doing that.
Yeah, that's actually a great point. A lot of people are not educated on chiropractic care, which is why I'm doing this podcast so people can learn more about it. But whenever a woman does go through a pregnancy, that can cause those misalignments. That can cause those nerve pressures to the spine. So they definitely should be getting checked and evaluated and getting adjusted.
Okay.
So let's deep dive into some of those specifics that you talked about earlier a little bit. So you would say the brain and the spine is of similar importance to the body, or one is. I know the brain is probably just the of highest importance, but you would say the spine is right there by it because it connects everything else in the body.
Yeah, exactly. The brain and the spine, they work together. Right. The spine protects the nervous system, and that brain sends that information to your body through those nerves.
Right.
So that's the only way it can get there. So that's that constant communication between the brain and body.
When we go to yoga, they speak about the balance of the body, where if your back is stronger than your front area, then you'll feel pain in certain areas. Or if your back is weak, then if your front is weak and your back hurts and stuff like that. What's that alignment like? Because I know sometimes even when you experience back pain, it's your groins are too tight or something of the sort. So what's the connection with your front and your back, basically?
Well, when it comes to the human body, everything is about balance. So, you got your right side of your body, the left side of the body, the front and back. They all should be proportional and balanced. And even when it comes to all the systems in the body, everything is about there being a balance. they be in a balance with your, your blood pressure. Your blood pressure should not be too high, too low. Your cholesterol levels, your heart rate. So yeah, it's all connected, and it's all about balance and all about that flow.
Right. So you talk about some of you actually talked about a few of them, but I want you to get into more specifics of some of the benefits of chiropractic care, because a lot of people only go most times when they're in accidents. When an accident happened, that's that's the most you see people at the chiropractor office. But you talked about you even sitting bad. Like a lot of people sit in the chairs at work all day, and you don't have a lumbar pillow, so now your back is out of alignment. And a lot of people wouldn't even think to go to a chiropractor for something like that, like I said. So get into more specifics of the cause and effect of why a lot of people would need to go to see chiropractic care.
Well, the reason why people need to go is because the brain is what controls everything in the body. And when you have those spinal misalignments and those nerve pressures, it's going to interfere with that communication between the brain and body. That can cause issues. Not only can it lead to joint pain, back pain, but it can also cause those other issues that I just mentioned. Some things you might not notice, you might not think it's related, but it is related. Because we're dealing with balancing the nervous system, which controls everything in the human body. And with everything that's going on now, especially with people's health, we all need to be at our best and allow the brain and body to be balanced and to communicate with each other.
Okay.
When I had chiropractic surgery, when I had spine surgery back in February, and I couldn't maneuver my lower back after the surgery. Like I remember the second day, it literally felt as if my brain stopped working along with my back, if that makes sense. Like not stopped working, but it was so much confusion at one point, and I don't know if it was because of the meds or just the pain. Like when the pain would kick in, like it would literally bring me to tears. So when you do mention, how like the connection it has with the brain, I remember trying to explain that to my mom. Like it feels like I'm not myself because I could not maneuver myself, my body, even like trying to move. Like I would literally just start crying because it was like my brain and I'm telling my body to move, but it's not moving. You know what I mean?
I totally get that.
So that makes a lot of sense. I don't know if I in the beginning, but what made you at 13 say you wanted to do this? I didn't hear that part.
Well, it was after talking to the chiropractor, he explained it to me, and I just connected to it. I connected to, that ability of the brain being able to heal itself, your body being able to heal itself. It just made so much sense to me, and I just felt like, this is a way that I could really help a lot of people, and serve a lot of people, and just help them get better.
What made you connect with a chiropractor at 13?
He was actually doing the sports physicals for the football team.
Okay.
So, and I was asking what kind of doctor he was.
Okay.
And,
So you didn't have no aspirations of being a professional football player, even though you going to college?
Oh yeah, definitely. I definitely did. When I played, I started when I first came in, my grades were not really up to par. So when I came in, they had a program called Prop 48. So I was eligible for my scholarship, but I had to pay my own way through school my first year. And as long as I maintained a C average, I was eligible for the scholarship the year after. But I would only have 3 years of eligibility to play. So, I went to school, I did really good in school, and I became a better student when I was in college. When I was in high school, I just didn't take it seriously, didn't realize how important it was. But once I realized a lot of doors closed on me because my grades were not up to par, then that's when I became more serious about my education.
So you say about that stigma that when you go to school for a scholarship, you have to focus on playing sports. Like your education takes a back seat to that. Because I know a lot of athletes. I used to play basketball, and I played pro for 3 years. But meeting a lot of these guys that didn't make it to the league, that was one of the things that they have nothing to fall back on, because when you go to college, you're solely focused on playing sports. Like, that's what you're there for. Everything else is secondary to that. So what was that like for you on that scholarship? Was it you still had to go to class and get good grades because they're not required? When we're in high school, if you don't pass, you can't play. That is the motto. You have to pass the classes in order to play. So what is that like in college, like when you got that scholarship?
Well, in college is more like a job. You know, of course, you don't have your parents there to make you get up, make sure you're doing your homework. I mean, you do have your coaches there to help you out with that, but really, it's really more on your shoulders to make sure that you're doing your assignments, that you're getting your work. I would say, it was a little more stressful than high school, and then trying to manage sports. It's all about time management. So that was a skill you had to learn. You had to develop time management with schoolwork and sports. And I know when we were during the season, I would take the least amount of classes I had to take, so I can dedicate time to watching film, practicing. And then when the season was over with, I would take more classes. And I would even go to summer school, so I didn't have to take a ton of classes during the season. So it's just a matter of planning and managing your time.
Yeah, I feel like even when a lot of football players, even basketball players, they cut their time short because, to be honest, a lot of them don't have nothing to fall back on if they should go to the league and get injured. A lot of guys don't have an education to say I have a degree in anything, because if you play ball for the first 2 years and you could enter the draft, that's the first thing you're going to do. You're going to enter the draft in order to get that fast money. But a lot of guys never took the education part seriously. You get what I'm saying? And when I talked to Traquan Smith, he plays for, I don't remember who he plays for now. I think it's the Raiders. He plays for the Raiders now. But we talked about it, and he was like, they never got certain experiences, because when you're in like elementary coming up, high school, you breathe, you live football, and you go to college, it's even worse. So you don't have certain experiences like we have, because you're going to camps every weekend. You have to be at games, you have to be at practice. So their social life is kind of cut short also. So a lot of experiences they don't have. Then you don't have financial experience when you get this fast money, because you're coming from going to college broke, your family broke, to going to the league, and now you're making millions of dollars just like that. So now you have no education on what to do with your money. That's why a lot of players go broke so fast if they should get injured or after the league. So I always wanted to know, like, when a lot of people go to college, because I didn't go to college here. I went to high school in Jamaica and came here. I didn't play ball in college or anything. So I always was fascinated with trying to find out what's the mindset like when you go to college now and you're on a scholarship. You might go to the league, you might not. Yeah. But do you take your education seriously? Because I wish somebody would have paid for my damn education.
What did you major in?
My major was biology.
Biology. Okay.
When I first got to college, I was a little undecided. But I made my decision after the first year of being there. But back to what you was talking about, I do remember when I was in college, I remember we had some players, they were, they're really serious about the sport. They were really serious about going pro. And I do remember some of them saying, if this don't work out, they don't know what they're going to do. Yeah. And because they just, that's all they know. But, and those particular teammates I had that were, that felt that way, I haven't talked to them since. I'm not sure what they did, but I know they did graduate. So they do have the education to fall back on.
Yeah, a lot of them don't, and that's the problem.
Yeah,
I seen it. I seen guys go on drugs. The guys go the wrong way. I had a friend that he came from Minnesota to come down here, and he got killed when he went back home because they don't have another option. And they go to that life. Because you leave school, you think you're going to make it to the league, and you're chasing that dream until you're 40, you're 50. You're still trying to go to the league at 50 or 40 years old because that was always your dream. Yeah. And you believe so much, nobody can tell you nothing.
Yeah. So. Yeah, and when I graduated college, I was working, and I was missing football. I still had that love. So I played semi-pro football in Charlotte, North Carolina. I played for about 3 years, And I got to tell you, man, I had more fun playing semi-pro than playing college.
Yeah.
And, and when I did play semi-pro, we had some guys that could ball. They could play in the league. They just were not college material.
No.
And, I did that for 3 years, and then that's when I decided to go back to school, and I stopped playing.
What's one of the reasons why a lot of people come into the office? Even athletes. I know athletes come into your office too, I bet. But what's one of the couple of the main reasons why people would show up in your office needing help?
Well, we do a lot of chiropractic care along with physical therapy. So we get a lot of people that that do come in when they have pain.
Right.
Whether it's from an auto accident, slip fall, sports injuries, work injuries. That's when they normally come in. And I'm trying to educate more people about don't just use pain as an indicator for you to come in. You should come in even when you don't have pain. 'Cause like I was saying, everyone has these nerve pressures and these spinal misalignments. Our bodies are in a better position, when the spine is balanced.
Right. My chiropractor would just let me lay down and was like, "Oh, your body's out of alignment." I'm like, "How the hell do you know that?"
But you know what though, chiropractic care, there's the art to it. There's the science and there's the philosophy. The part you're talking about is the art.
Right.
Like I can be in a mall, I can see somebody walking, I can tell if the right hip is higher, if they got if they got a bad hip, if one shoulder is higher than the other. Sometimes I can just, when the patient is laying on the table, I can look at them and just tell what's wrong. Or when I touch their back, I can just feel it. It's kind of hard to explain, but I guess that's like the art part of it.
Right.
Like, when an artist plays the guitar or plays the saxophone.
That's like us being hairstylists. Like, I could be like, oh gosh, her ends are horrible. She needs to trim it.
Yep, you're right.
And we have an eye for it. Like, you see it. Like, okay, this is wrong. This needs to be fixed. This is
It's like playing ball.
Yeah,
like, that one guy that walk in the gym like he can't hoop for nothing.
Yeah, exactly. And then you see some guys where you see them the first play, you're like, oh, he can play.
Yeah,
you know it instantly.
Right.
It's the same thing.
You can tell by how some guys walk, because you see guys walk in the gym, you're like, yo, he look like he could hoop.
Yeah.
And but I don't know about football, but basketball, you can always tell.
Yeah.
And then there's guys, once they bounce the ball one time, you're like, he's trash. You know what I'm saying?
But, I will admit this in football, too. I've seen some guys, maybe when they were young, you was like, oh, man, they can't play. And by that senior season, they're like all state and they really improve.
Right.
I've seen that, too. I don't know if it's a growth spur or whatever, but sometimes that happens, too.
I think it's a brain development thing.
I was going to say, like, maybe mind over matter. Like, they have to get their head in the game better to before.
It's overtime. It's overtime, trust me, because I know guys, like, a perfect example, Shaquille O'Neal. He didn't start playing ball until what, college? And he's huge.
He's
so
huge, yeah.
Oh, wow, I didn't know that.
Yeah, he didn't start playing ball till like college or something like that.
Yeah.
And he made it to the league. You get what I'm saying? He still can't make free throws, but he developed what skill he had, which is just bouncing people and dunking the ball.
Yeah.
That's all he needed to do. But he didn't play high school ball. He didn't do any of that. He was a sheriff in the police officer or some shit like that. Like, he was not a basketball player before he was.
That's why he didn't stay in it for too long. I have a question though. When he was in college, did they make chiropractic therapy important, like to have, like to
like when you were playing ball?
Yeah, like is it something like, because I know you guys like even massages, like is that something where they say you guys have to do this once a month or whatever?
Well, when I was in undergraduate at South Carolina State, we did have a chiropractor. He actually went to the same chiropractic school I went to, which is Life University. He would actually come, to our practices and give the whole team adjustments. I think he did it maybe every 2 weeks. That was that was actually my second exposure to chiropractic care, besides high school. But I don't know how it is now, but I think it can really help to improve, athletes' performances.
I think it should be required in high school and college. I know in pro level they have physical therapists, they have chiropractors, they have masseuse, like all of those they come with being a pro. But I think having it on a high school level will teach guys to take care of their bodies, because, like I said, when I played semi-pro ball, I've seen so many guys that really did not know how to take care of their bodies. You get what I'm saying?
Yeah.
They didn't know to get massages. They didn't know how to stretch. They didn't know body alignment. They didn't know that even sleep really helps to improve your game. Like stuff like that, they didn't even know because guys used to come to practice like smelling like alcohol, smelling like weed, because they didn't care. They didn't think that would affect their game at all. So I think implementing that in school early, will teach a lot of guys how to even with the food they put in their bodies, how to take care of themselves early.
But you know, I think they are doing that now. You know, a lot of the young athletes, high school kids now, they're now getting a lot of that stuff.
Right.
That's why, you know, we have these freakish athletes now.
Yeah.
You know, in all these sports now.
These young boys,
because they're starting early.
Yeah.
And I definitely think these physical sports definitely to have it. Like for, you know, American football, you know, every time you get hit, that's like a car accident.
Yeah.
You know, I remember after some games, the next day I could barely walk.
Right.
And I'm like, how am I going to practice on Monday or Tuesday?
I always say that's one sport I could never play.
Yeah, it's rough on the body.
Yeah, no matter how much you work out and your muscles absorb that, I still think you're gonna feel that at some point.
Yeah, you're gonna feel it. You know, and by you know, Wednesday your body start feeling good. Thursday, like, okay, I can go. But it was every week. It was just like that.
One more question about football before we move on. Does that helmet really protect your head? Like, really protect you from those hits? Because
it does protect you, but you still can have concussions.
Right.
And, you know, and that's one of the reasons why football players have to wear the mouthpiece, because that helps to reduce the concussions. Because, you know, when you
just the mouthpiece?
Yeah, wow. the mouthpiece alone. Because when you take a blow to the head, you know, your teeth clash down, and that vibration, you know, rattles the brain.
Rattles your whole head, basically.
Yeah, so, you know, it's important for football players to wear the mouthpiece. But I remember, you know, playing quarterback, you know, sometimes we have to talk. So for us, it's a little different. You got to take it out. Right. Like you get to the line of scrimmage, you call the play, you got to take the mouthpiece out to call the play or change the play. But, you know, you want to wear that mouthpiece. So I would put it back in, and, you know, but I see a lot of the professional quarterbacks now, they don't really wear their mouthpiece.
I mean, they trust their blockers too much.
As much, which, you know, is a trip to me. But, you know, and today's football, they're protecting the quarterbacks so much, you know, they can get away with it.
But why are the contracts not guaranteed? It was the most dangerous sport. That's what I never understood.
That's the Players Association. They gotta fight for their rights, man.
That's crazy because basketball is guaranteed.
Yeah.
You know, like other sports are guaranteed. Like if you get hurt in the middle of your contract, you're not getting the rest of your money. Yeah. You know, I've seen guys leave the league with an Achilles tear, and you got to go back to work.
I wonder if they do like brain CAT scans and stuff before, because football players are not the smartest, and you know, especially after they're done. No,
it's not that. It's not. I don't think a lot of them is not that they're not the smartest.
So much.
I don't think that's what it is. Like we were talking about earlier, football takes another level of dedication.
Yeah, it does. And a lot of people don't know this about football. Football is very complex. You know, you can't be a dummy playing football.
Right. That's what I was about to tell you.
It's like playing chess. You know, like as a quarterback, you come to the line of scrimmage, you're thinking about 5-6 different things at the same time within seconds.
You got to be able to predict.
Yeah. Well, I was speaking about like after they retire and just mentally. I watched a documentary where they were talking about them getting hit and these concussions and just their mental state of mind.
Yeah,
a lot of that is new now because, you know, with CTE, you know, now they're evaluating athletes for it, or football players more for it, you know, for that. So that's kind of developing. But I do think it is affecting players as they get older, you know, with CTE, it can cause issues with the brain. They're not acting themselves. They suffer from depression. You know, they have like these bipolar episodes sometimes. You know, we're kind of now learning these effects on the brain now.
A part of that with chiropractic care, I know you must see this a lot where, because for us as athletes, you get hit 2 years ago and now you start to feel it this year. You know what I'm saying? Like later down in life, you start to feel these hits that you thought healed up, but I learned that certain injuries never fully heal. You get me? So, like even your ankle, right? I always have ankle problems, and they never fully heal. And a doctor told me that that's one of the tendons that always, if you sprain it or twist it a certain way, is going to always be there. You might not feel it at the moment, but I realized that if I don't work out for a while, if I don't play ball for a while, I feel a lot of these injuries.
Yeah.
So that's why a lot of times I try to stay active. Do people come in like for random pain? Like the pain just comes out of nowhere, but they think it comes out of nowhere, but it's something that happened before.
When patients do come in, that's why I do, a very thorough initial exam, ask them about their health history, so I can kind of pinpoint those injuries they may have had in the past and forgotten about,
Right.
which could be the cause of the current pain they have now. And you are right about those injuries, because when you do suffer an injury, when you have an injury, you probably have some type of tear, whether it's a micro tear, a very small tear, but it's going to heal that area with some scar tissue.
Right.
So that area is never really going to be the same, and that can kind of set you up for early degeneration in those areas as you age.
So whenever I go to the chiropractor, one thing they always throw in there is electric therapy. Like, how does that work? Because I don't know how does electricity help to heal anything that's going on?
Well, what it's basically is doing is basically exciting those muscles, exciting those muscles, so those muscles become active. They work. That brings more blood flow to the area, so it kind of flushes the
Toxins.
lymphatic system, kind of removes the toxins, removes the inflammation. That's pretty much how that works.
I knew it had something to do with, like you said, the blood flow, because electricity. Our body's naturally electric, right? I guess that just adds to that electricity that your body already has. So I didn't know that.
Yeah. So what would you say is like the most rewarding and the most difficult part?
Start with the rewarding part first.
Yeah.
The most rewarding thing is actually helping people. They come into your office. Pain is depression. It can really bring you down. So to get them feeling better, have them, leave feeling better, within a week or 2 weeks, they're smiling again. That's probably the most rewarding thing.
What's the downside?
I would say the downside is, you're giving up your energy to help people. And sometimes that can be a little draining. When you help anybody, you gotta. Well, whenever there's a give and take. So it's kind of hard to describe, but when you're treating people, you're kind of giving up your energy,
Right.
and that can just be draining over time.
Do you have a chiropractor?
Oh yes, I do. I have actually I have one of my buddies that I went to school with, and I try to go and see him at least every 2 or 3 weeks to get adjusted.
So what does your self-care look like as a chiropractor?
My self-care for me?
Full self-care, yeah. Like, what does that look like? Like, you go to therapy, the gym, whatever it is that you do for your self-care. What does that look like?
Oh, for my self-care, I try to stay active with cardio and weights. I work out at least 4 times a week. My days I work out is normally Friday, Saturday, Sunday, and Monday.
Oh, I can't.
And I try my best to do it, and I've been doing pretty good at it. But as I've aged, I've changed up the way I work out. I don't work out like I used to work out when I played football. When I go in there, I do light weights. I do as many as I can for 35 seconds, and I rest for 35 seconds.
So you do timed workout?
Yeah, I kind of do circuits. So I'm kind of working cardio and I'm doing weights at the same time, and I'm able to knock it out quick. So I'm not in there a long time. I'm in there about 35 minutes. I'm in and out.
Right.
So I don't dread working out as much. And I really enjoy it.
Right. So for me, self-care means so much things. It's something simple as taking a trip. For me, self-care. Something as simple as going to get a massage, and like I even go to the chiropractor. That's self-care for me. I go get my facials, I get my pedicures. Those things for me are self-care for me. So I go to therapy, and they're even coming here for me. I consider it self-care because I get to have dialogues and learn. Because we don't talk about that side of enjoying learning. A lot of us look at learning as a hindrance or something that takes up our time. A lot of us don't talk about learning as being enjoyable, because people will ask you, what do you do for fun? Not realizing that learning can be fun. You know what I'm saying? Learning can be something you do in your spare time. We always talk about going to party and do stuff like that, but we also can enjoy learning. So all those things put together for me is a part of self-care, and that it helps to improve the quality for me. What about you, Shaq?
Well, I agree with that. And what I wanted to ask him is continuing education something that chiropractors do? Is that mandatory for you guys, or you guys?
Yeah, it's mandatory for us. Every year we have to get at least 20 hours of continuing education.
Oh, okay.
And we have to get 40 within every 2 years.
Okay.
So it definitely is part of our.
So it's like an update. You gotta go get an update every.
Yeah, pretty much. We get reminded about the same things
Right.
when it comes to ethics and boundaries, and we also, we have the opportunity to learn some new stuff, some new stuff that are coming down the trends when it comes to healthcare and stuff like that.
So we had a chiropractor on before, and we asked him this question about. I think there was a talk somewhere about like the clash between physical therapy and chiropractic care, because some physical therapists will tell you don't need a chiropractor, and a chiropractor will tell you probably don't need to go to physical therapy. So do you think they work hand in hand, or you just one that just don't? If you have one, you don't need the other.
I actually think we work hand in hand because we kind of do the same thing. When it comes to chiropractic care, you have some chiropractors that are just straight chiropractic care. We call them straight chiropractors. They don't do any mixing, which means that they don't do any physical therapy. They just do the adjustment, and their focus is the philosophy that the body heals itself by the spine being balanced.
Right.
I'm more, I guess, they would call me more of a mixer because I do physical therapy. I do, like you just mentioned, the electrical muscle stimulation.
Right.
I do shockwave therapy, ice heat therapy. I do anything I can to help the patient get better. That's my goal. So just using all my tools that I have that I have access to.
Okay. So when you leave work, right? Do you try to, I wouldn't say push it on family, but kind of require the family to get adjustments, sit a certain way, because when you have the education, you're like, yo, stop sitting hunching over, you know what I'm saying? Like, you're like, for us, we would like to drive, leaning back, stuff like that. Because for me, when I was a personal trainer, I would tell everybody, you need to go to the gym. Like, we're not going to do that. We all go into the gym, we're all going to work out, whatever the case may be. Do you take that home, like, required of your family to,
No, not necessarily. They know they can always ask me if they want an adjustment or if they want to, or if they want some care. I don't get so anal about making sure you sit proper or things like that. So I will educate them on healthcare and chiropractic care. If they ask me any questions about any advice about if they want to do something, I'm here to offer advice about it. But I don't force my opinion on that.
Right.
I educate them and leave it up to them to make the decision.
So how, now we had Drew on and he was talking about, you guys working with the lawyers and the lawyers and not the physical therapists. Was it just chiropractors and lawyers?
Chiropractors and lawyers.
And doctors,
and the marketers, chiropractors, lawyers.
Yeah. So how is that?
Oh yes, and orthos.
And orthos, yeah. So how is that working with? Because I just being a hairstylist, and we have to certain things we can't touch. As far as like if they come in and they have certain scalp issues like abrasions and stuff, and we can't, like, we have to recommend them to go to see a dermatologist to see what's going on with their scalp. So how is that working with other like, how does it affect your work? As far as having to work with those other people.
What you're basically talking about is just basically coordinating the patient's care. A patient might come in, let's say they might be coming in for neck pain, but they might have an issue that's more serious. Maybe they could be suffering a stroke. Like one of the signs of a stroke could be neck pain. And we have to
wait. So back up a little bit before you go any further. So neck pain is a sign that you might be getting a stroke.
Silent stroke.
It could be. It's possible. It could be. You could have neck pain. You could have dizziness, double vision. So we're trained on how to recognize those things. So so we can get the patient properly sent to someone that can help them.
Right.
And not just assume that it's just the issue from the neck. But also, if I have a patient who I'm treating, they're not getting better, they might need more help. They might need a steroid injection to help with the pain or reduce the inflammation. So I might have to refer them out to an orthopedic doctor. Or, I might have a patient who I'm doing physical therapy, but they're not getting better with me. So I might refer them to another physical, to another physical therapist that may be able to help them out better.
Okay. And how does the lawyer comes in mostly when you have accidents?
Yeah, the attorneys comes in, when we also treat personal injury cases, those are slip falls, auto accidents, and when those people are injured, the accident was not their fault. They may be suing their fault company, their fault insurance company for the injuries. So that's when the attorney comes into play.
Okay.
So, the attorney represents them, and, it's just our job to diagnose them, treat them for the injuries, and get them better. And the attorney's job is to handle their legal side.
Right. Go ahead.
Is there any frustration in that with having to deal with the attorneys and,
from patient attorney to different people?
Right. Because, I'm not going to say too much, but I know where there's instances where, maybe there's an accident and a person doesn't feel like they need the therapy, or whoever was in the accident, and they try to push it onto like the chiropractor, like, oh yeah, and I like, let me just go a little bit more specific. So there was an issue where there was an accident. There was 2 people involved, and the person, it was like 2 family members. So like, let's say husband and wife or whatever, or child and parent or whatever. And one of the persons go to let's do child and parent, to go and get seen by the chiropractor. And because you're a legal guardian over the person that was in the accident, as far as lawyers, they want you to kind of get more people, so that you can get a bigger settlement or whatever it is. And there was a specific instance where they wanted the person to like force their child to kind of like go to the chiropractor even though they wasn't having any pain or anything. Okay. And I don't know if it's because after a while you can feel the pain, or I don't know if it's because, but the chiropractor in that instant, they were a little like frustrated because they're like, well, it's later on, and it's like you want to now force it on, So where does it get like complicated?
Well, I would say in those type of situations, I listen to the patient. If they're telling me they're not having pain, I'm not going to force them. I'm not going to diagnose them with something that they don't have. That's pretty much it. And
sometimes the lawyer would try to push for them to go, because I've seen instances like that where the lawyer is like, a lot of people, if we're being honest, a lot of people don't feel the pain right away. Right. Because for me, when I got in my accident, my back felt a little stiff, but I was like, I'm used to that because I play ball. So a couple of weeks later, like, the pain hit. And that's when I was telling the lawyer, like, I don't need to go to no chiropractor. But after that following week, I was over there. Yeah. So a lot of times when the lawyer would tell you, go get checked out, you never know, something might be wrong, you know what I'm saying? Because if you turn it down and then you try to go back again, you might have to pay for it out of your own pocket.
Well, what you describe, and maybe the situation is, the attorney may want the patient to be evaluated to at least so that it's documented. Because like you were saying, that is possible. You might be fine now, but, the pain could get worse later. That is possible. So, just having that evaluation documented, is also good also.
Especially when it comes to like adrenaline. Like, I've seen guys finish a full soccer game with a broken foot. Like, his foot was broken at halftime and he finished the whole game not knowing that his foot was broken. And when he took the gear off, his foot was like this big. Because he didn't know.
Adrenaline was moving.
Right. Yeah. And they told him to get off the field, but he was like, nah, I'm fine. And he played the whole game running normally underfoot. And his foot was broken.
And there's also another issue with, when you get into an auto accident, everyone has PIP coverage. PIP is personal injury protection. Yeah. That's medical benefits, so you can get treatment or see a doctor for any injuries. But you only have 14 days after the day of the accident to see any physician for those injuries. So maybe the attorney just wants them to be evaluated, so at least it's documented that an exam was done within the 14 days, just in case, let's say 4 weeks later, pain comes on, and now they can tap into the rest of those benefits and get that treatment and medical care.
All right. So go ahead, Sean.
Why is it emotional when you get an adjustment?
What you mean emotion?
Because you do get emotional sometimes. Like there's been times where I literally want to it's like happy tears.
What?
It's like a release of just like, okay, I've even seen pets get, adjusted, and they're just like it's a sense of emotion that comes out.
I didn't even hear that.
Well, it's actually a shock to the nervous system. When you do get adjusted, it does release some natural endorphins, serotonin and et cetera. So, you do kind of get a natural high after you get an adjustment, and but it's basically a shock to the nervous system.
Yeah.
And you got to remember the nervous system, has a flow of cerebrospinal fluid.
Okay.
So that's that balance, that flow I was talking about. Mm-hmm. So whenever you have misalignments, it can interfere with that flow. When that segment of vertebrae is back in the proper alignment, that energy, that flow starts flowing like it's supposed to. So that could be a rush that you feel.
Okay.
It could be
It's a natural way to get high. Y'all don't go over there. Y'all don't be going over there talking about, I'm just here because I want to feel good. No, do not go over there for that. Because I know y'all love to get high on anything. Like,
oh my God.
Especially the weed smokers.
It just gets, don't even start. It just gets, I don't know, it's something about it that just, I don't know. Maybe it's just me.
So I don't know if you guys do this. I know a lot of not only chiropractors do. I talk to a lot of holistic doctors that also do. But talk about preventative measures, because what we realize is in the medical industry, not even chiropractors or just dentists or whoever, they don't preach preventative measures because they make money if something is wrong. So you're not going to tell you a solution in order for you not to end up in my office. You know what I'm saying? But do you give those advices like what to do to prevent these whatever injuries or misalignments, or like you say, even something as simple as throwing your spine out of alignment by walking bad or some of the sort? Do you give that like a list of things to avoid, having those problems?
Well, I would say, the advice that I normally get is just reduce your stress. Those misalignments and those nerve pressure are caused by stress. And I mean, we all get bombarded with stress in life, but we can do things to reduce it. And stress can come about, from, it can be a physical stress, could be an emotional stress from work, family, friends.
So emotional stress affects the body.
Yeah, that affects the body too. And it affects the nervous system, and it does cause those misalignments.
Okay.
So it's kind of like a chain reaction.
So if you go through a breakup, you might...
You need a good alignment.
Yep, you could. It can cause misalignments to the spine.
Really?
Yep.
Because you're probably just like, your body posture changes, you just...
Yeah, exactly.
It's
all a brain and body connection.
I mean,
it's all connected.
I'm walking with my chest higher though. So
But another stressor is environmental, which could be the foods you eat, which could be prescription drugs you take.
Are you
which
saying?
Which could also recreational drugs.
Are you saying?
All those are stressors to the body.
That smoking weed could affect the body?
Yeah, it could, yeah.
I'm gonna just stop doing this podcast today.
You mean if Drew if Drew and Shan...
What's wrong with him? It can also relieve a lot of stress as well and loosen up your muscles after a long day.
That is true. That's true also.
CBD
maybe smoking nicotine and tobacco is...
Of course, that is definitely bad. But I feel like, all right, so this is how we think of it, right? Anything you put fire to loses its full medicinal properties. No matter if it's weed, if it's food, if you boil your food or cook your food, it loses a lot of medicinal properties. So my thing is, yes, marijuana is a medicine, but I feel like when you put fire to it, it loses the real benefits that you're supposed to get from it. Now you're just getting high. You know what I'm saying? Like a lot of people do try to use it for other purposes, like smoking the plant, but I feel like the majority just like the feeling of getting high. That is just my a lot of people are drug addicts. They're functioning drug addicts who smoke weed because a lot of people can't do without it.
Yeah.
You know, they're fiend for it. So if you get to the point where you're doing it for the right reasons, I support it.
Yeah.
But a lot of people are doing it just to get high.
Yeah.
It's just like a crackhead. Like to
And
me,
I
you
have
just doing
had
it to
some
get high.
patients, who do it medicinally, for
Right.
medical reasons. And, they do say it really does help them.
It
helps
can,
their pain.
because I believe it can.
And, it helps to reduce stress. Yeah.
When I used to go to the chiropractor and get adjusted, I'm high every time because I have to relax. And it helps me like really relax.
So you mean you're depending on it? That's what you're saying.
No, I'm not. But I would prefer to be high. I've been not high, but for the most part, yeah, I like to have a nice, little.
So
buzz
basically,
going,
it's not really.
And I'm just like relaxed.
It's not medicinal for you. It's just for you to get high and enjoy the experience better. That's what you're saying.
For the most part, yeah. I don't need to wake up and smoke weed. I've passed those stages. I'm getting
You used
too
to be
old.
there. Is what you're saying.
That was when I first started doing hair. Axe 88. What? I'm high in here all the time, and I felt like I was more creative. I was more relaxed. I take on any client, like their energy doesn't matter what it is. It gives a different. It gives you a different. I don't know. It just relaxes you more.
Nah, see, what I believe is people like who get high they don't really have fun, they don't, because like you said, they're always relaxed and chill and floating. I don't feel like,
but it's probably it's probably
right.
like a balance.
Alcoholic.
No, so with alcohol, it's a lot of sugar, so of course you're gonna get hyped. You can't compare that to alcohol is bad too.
And
it's completely bad. Don't get me
exactly.
wrong, but don't.
Well, let me tell you this.
Okay.
My trainer said, "Don't drink, but you can smoke."
You're
Because he
stupid.
knows that the alcohol is worse. It will be worse for me. But he's like, smoking is fine. Some people even smoke weed before they go work out because they get a better workout.
Nah, see, that don't make no sense either, because most of you smoke weed just want to go, float somewhere. You don't want to work out. Oh, like this.
But I have heard some people say that it gives them, like you're saying, a little more focus.
Yeah.
It kind of creates like a tunnel vision.
Yeah. And it depends. It affects everybody differently.
Yeah, that's what I believe.
It
I
definitely.
believe
And
that.
like I said, I can't. If I don't have a long day, I have a whole bunch of errands. I'm not gonna wake up and smoke weed. I used to back in the day. I was younger before I had a child. Like I was like go, but now it's like more of a. It's like my dessert. I go home, I relax, smoke a joint.
The thing is, I don't have a problem with the person doing it and it benefits them in those ways where it's physically benefiting. But when a person is using one like the other one, now you have a problem. You get what I'm saying? Like you're literally abusing the product. So that is where
You said using one like the other.
Right, I mean, you finish with one and use that one to light the next one. Like you literally are back to back with
weed
it.
doesn't
You're
do
smoking
that.
5 blunts
No,
a
honey,
day.
we don't do that. Weed stops. Once you stop it, it stops itself.
You
Not
can't
like
say
a
we, say
cigarette.
you.
No, marijuana doesn't. You can't light a marijuana.
Who told you that?
It's not as
Where you
easy as a
from?
cigarette.
What? No, I'm telling you. I've seen it.
But you know what? When I played football, we did have some guys that would do it before games, and they claim it helped them with their focus.
Yeah.
And that made me think about I don't know if you guys remember the female Olympic runner.
The hood one with all the wigs and stuff like that. That's what
Remember
Sha'Carri?
she got disqualified.
Sha'Carri, yeah.
For smoking weed.
Yeah.
For smoking weed.
Yeah.
And they said it was due to drug enhancement. And I'm like, are they telling me weed is a drug enhancement
They call
drug?
it. They say it's an enhancement drug. Yeah.
So I said, oh.
But now it's legal to smoke in the NBA. It's legal to use the product and then go play ball now. So.
Okay.
I don't know. Honestly, I just feel like I said, it's necessary for healing, but a lot of people abuse it. That's what I think. That's just what I think.
If you're not focused and you can't do anything with it and you can't be productive, then you shouldn't be smoking weed. I don't think you should be doing that.
I mean, yeah, I don't.
You got to be productive.
I never
with
got
it.
high, so I can't really.
Yeah, that's
judge
why you should
someone.
stop talking about it.
I'm never gonna get high. Never, ever.
You should just stop
I don't
talking
need
about
to.
it.
I don't
about
need to. I think it's mental. It's more. Yeah, let me not get into that.
It's a beautiful
y'all got
plant.
mental. Y'all got
Leave it
issues.
alone. It's a beautiful plant.
Y'all got issues. This year I can't. You're defending weed. You're defending weed like it's one of your kids. Like this point. Like
Because there's nothing wrong with it. God put it on this earth. He didn't put alcohol on it.
You know that all these drugs are made from plants too.
Oh yeah, they definitely
Yeah.
are.
Okay, just to let you know, so God put it on the earth too.
Yeah.
But when it comes to the prescription drugs, they change some molecules so they
Yeah,
can
a lot of
patent
it.
it, make some
Yeah.
money off of it.
Mm-hmm.
But most of those drugs, you can get them from roots, leaves, plants, and etc.
Do you guys ever practice any? Because I know you don't prescribe drugs.
No,
so
as chiropractors, we
You
don't.
can't.
Yeah, we don't prescribe
the ortho does that.
prescriptions. Yeah, the ortho is medical doctors can, but chiropractors we don't.
Okay, so you have to have a special license for that.
Well, I know all medical doctors can prescribe medication. I don't know if they have to have a certain certification, for it, but they can prescribe medication.
So, what methods of pain management do you recommend? Like, if you should come to the office and the pain doesn't go away fully, let's say you say when you go home, these are the things you can do to manage the pain until the next time you come back. What are some of those things?
I advise them to take some ibuprofen. It's a non-anti-inflammatory over the counter that they can take. Icing. I've even advised some patients to take the THC Delta 8. Or if they can get the cannabis cards, to take them medicinally if they're really in that much of pain. But of course, they got to go and see a medical doctor.
Yes.
In order to get that prescription.
But for a person that has that type of pain, you go home with it and nothing is working. Now you send
and that's
them
the
somewhere
first
else.
thing. We'll try therapy first, chiropractic care, and if they're not improving, that's when we need to do something different. We need to change something up.
Okay. Yeah. So
Speaking of improvement, is there anything in this field that you do now? Because like we all know, people going to have chiropractic therapy is not the norm unless they're in fully pain. So, is there anything that you would say needs to be improved in this field to get more people to come in?
Just more educating the people about
educating
chiropractic care. They have a lot of people have superstitions about it. Getting adjustment. We're gonna break their bone, or they might have a stroke, which the percentages of that are very low. So just educating more people about it.
even that neck one. That's the one I'm scared of.
Yeah, that's what a lot
that
of people
one's scary.
tend to be scared of.
That's why you got to be high when you go get it.
Cut it out. Cut it out. All right? I don't trust it.
Okay.
I don't because I could pop my finger by myself, but I seen guys do this and they crick, crick. I'm like, nah, something wrong.
Yeah. I had to ask the other chiropractor we had on. And this was when we first started recording, so half the stuff we probably don't remember much until we watch the episode again. But do you recommend self-adjusting? So cracking your fingernail, cracking your fingers and stuff like that?
No, I don't recommend that. I would recommend stretching those joints, and if they happen to move, that's okay. Because sometimes the body would naturally adjust itself.
Right.
If you put the joint at a certain position.
Like if you turn a certain way, you hear a crick.
Yeah. Sometimes your body will adjust itself. If you turn and stretch. But I don't recommend anyone forcing that.
I went out the other night from not being out in a long time, and I was dancing. You know how we dance, and my back was just not working right.
Yeah,
and
because you have no rhythm.
But hold on, no, shut up. I did a certain movement, and it's like everything readjusted, and I was able to go dance all night.
That sounds like an example of your body adjusting itself.
Yeah, and I was like that when you said, I'm like, dang, I think my body adjusted itself that night.
You ain't got no rhythm.
Whatever.
All right,
but that's a reason why stretching is important too. A lot of people don't stretch, and when your muscles are tight, that can also cause misalignments to the spine.
Yeah,
Mainly
and that's what I was talking about.
area.
Yeah, for me, I know when I need to because my body gives those signals. Like my back pain is not necessarily just my back. Sometimes it's my groin because they said this is connected. Your whole lower area,
your
is
hamstrings, your quads, those abductor muscles in the inner part of your legs.
So even with my knee problems, sometimes I remember I went to a chiropractor office one time, and instead of I had a hip problem, but instead of stretching the hip and doing anything, he stretched these areas before, and then that pain kind of relieved because he was like, we focused on the wrong area. I had knee problems before where he focused on another area, and that knee problem went away. So everything is connected, like we're talking about with the balance.
if most people who have chronic back pain, if they was just stretch the hip flexors, the muscles in the leg, that alone will improve the back pain.
Yeah. So with my sciatica that I was telling you that I have, when I was telling people that, I'm having surgery because my sciatica is getting like really bad, and then also because of the injuries that I had, I want to say at least more than half the people that I told that I have sciatica, they were like, "Oh yeah, I have sciatica too." Like, and I'm like, "Well, what are you doing about it? Like, you just out here with this sciatica pain?" And they're like, "Oh yeah, I was supposed to get surgery for it, but I'm scared, or I don't go to the chiropractor as much." And one of the things after my surgery, they showed me the sciatica stretches, and I'm like, "There's sciatica stretches?" But when I was going to the chiropractor, they wasn't telling me that. So is that something that you recommend? Like, do you teach different stretches, or that because does the physical therapist have to more so do that? Like
no, that's part of what I do when I educate the patients.
Okay.
I show them stretches. I even have a program where I send them some stretches they can do at home.
Nice.
In the program they get videos on how to do it. There's an explanation there. So I do give them some advice on going home and stretching.
One of the main things that a lot of people have is the bulging disc. A lot of people have that, but I had it, and like I said, I went to the chiropractor. I did yoga. I did acupuncture. Acupuncture works. I did acupuncture. I did massages. I did everything. Like I was doing it constantly, because a lot of people, what they do is you'll do it once or twice.
Yeah.
Oh, it's not working, and I'm not going back.
Yeah,
it makes no damn sense. Like
you have to give it a chance to work.
Give it a chance to work. It works over time. You get what I'm saying? Like I was seeing a video the other day about healing and how healing works, where they had a cup with juice in there, and they turned the pipe on with water in the cup, and it shows how healing really works, because when that water fills up, the water gets clearer and clearer and clearer, and that is how healing works. It takes time. Same thing with the people that they say, "Oh, I ate healthy for 2 months, but it's not really working, as much." And I'm like, you've been eating unhealthy for 20, 30 years of your life. How does 3 months reverse that? That makes no sense. So I always tell people, stay consistent with something if you really want it to work. Sometimes it looks like it's not, but it's just a slow process of it working. So like from bulging disc, I feel like it can be reversed. It can be fixed. You just have to be consistent with that process of going to the chiropractor, going here, wherever it is you go to get that healing that you need. So I mean, that's one of the reasons why you need to be in the chiropractor office.
So is there anything else that you would like our audience to know about your field and what you do, that you can educate them on?
One thing I would like to announce is within the next 3-4 months, I'm going to be adding actual physical therapist services in my office, where we're going to have a licensed physical therapist and also a physical therapist assistant. So we'll be able to treat more patients. Like if you had, like for example, with you, if you had your back surgery and your medical doctor needed you to get physical therapy, they'll be able to come to us, and actually we can follow your doctor's prescription, for your physical therapy.
So like a one-stop shop.
Yeah.
Do you have massage therapists in your office?
Not currently, but that's something we may be adding also with the physical therapy.
If you get acupuncture, I'll be over there. I'll be coming over there, because I actually like it. I feel like it not only relaxes you, but I think it actually does work when it comes to pain.
I've always been afraid of acupuncture.
I was too, because I hate needles. I hate needles. I don't have none, but I hate needles. But when I was in that much pain, I was like, something got to work. Something had to.
And I think acupuncture is something like chiropractic care. You can't just do it one time and expect it to work. You're gonna have to be consistent with it and give it time, to work.
And don't you have to be really still with that? Like you can't move at all with that?
No, it's not like that. Okay. I mean, when you do it, yes, it's best to stay still, because, like I said, you're relaxed. You're relaxed. You're in a state of just relaxation. You're in a place where it's like meditating. So it forces you to stay still, and your mind stays still just the same. So not only does it work on your body, it helps with your mind. A lot of people don't know how to stay still. I realize that. Like a lot of people have no idea how to. So that helps you to stay still. Even with the fear of the needles, you don't want to move. So it forces you to. So I feel like a lot of people need it for that reason.
And where's your office?
My office is in Fort Lauderdale, in the Oakland Park area.
Okay.
Okay. You want to put the address out there?
Yeah, the address is 840 East Oakland Park Boulevard, Suite 114, Oakland Park, Florida.
You have online platforms on like a website, Instagram.
We do have a website. The website is betterwellnessclinic.com. Currently, we're at, I actually do have an Instagram. I can't remember the name of my Instagram. You remember the name? On Better Wellness Clinic. Okay, yeah. On Instagram, you can find me at Better Wellness Clinic also.
I think your page is kind of new, right?
Yeah. The page is fairly new. That's one of the things I'm working on is the social media. I'm trying to get that going and utilize it a little more.
Yeah, back in the day, it used to be just word of mouth. You know, word of mouth.
Things are different now.
Very different. So I suggest every business owner that's one thing you need to implement in the business of marketing. And that's what Drew does. Drew marketing, you know. He does it pretty well too. He passed me.
Yeah. Once people see you just out here just adjusting people on a daily, and they're gonna be like, you know what? I think I need to go get an adjustment.
Yeah. I've seen people online cricking necks and stuff, and I'm like, I'm not doing it, but good job.
Yeah.
So we always ask our guests. We do it amongst ourselves, all three of us, where we have a final thought that we want to leave our audience with. It could be about anything. Doesn't have to be about chiropractic care. It could literally be about life. Just leave the audience with some advice about something.
I would say kind of similar to what my intro was. You know, we all are students to life. You know, we don't know everything. We all must be willing to be coached, willing to learn, seek knowledge. You know, that's how we better ourselves. You know, I think our purpose here is to evolve. You know, to improve, and I think that's how we're going to get there.
Sure. You have to think about yours. You got time.
I normally comes to me, but I would just say just be aware of when you're stressing as a human, you know, just where your stress areas are and how and when you do acknowledge that you're stressing, have, you know, things in place to take you out of that, you know, and just leave it there and to just get into a better mental state and de-stress. That would be my Mine
would be remove blame from your vocabulary and learning how to take responsibility more for your own actions. Yes, there's things that happen in your life that you may have no control over, like your parents may have did it the wrong way. You may have bad experiences growing up, but it's your responsibility to go and try to fix that in order to move it on to the next generation. And Father's Day just passed. And when a lot of people ask me about not being a parent as yet, that's one of the things I asked them was like, are you healed enough to be a parent? A lot of people are parents, but they're not in the position to be parents, you know? So you're running to be a parent because it looks good, it's glamorous, and this child you think is going to make you happy or it'll take you out of depression that you're in. But I always recommend fixing yourself first, taking that responsibility to go seek the help out, you know, not only mentally, physically, emotionally, but also financially, because a lot of us are in situations where we're bringing children into the struggle that we're going through in the moment. You're going through this financial struggle, you have no way out, but you're bringing somebody else in there to share that with you that you have to take care of. Now you're not only figuring it out on your own, you're figuring out for yourself and this little person that's coming behind you. So I would say just make sure you take more responsibility moving forward with your life, because everything starts with you, you know?
I don't like when people force being a parent on people, because it's a mental thing. Like it's not easy. It's not easy at all, and not a lot of people not a lot of people are successful at it, you know. And it's something that it's one thing to come for you know, someone's parenting skills is when they're trying their hardest, but I don't like that. That's something that I don't agree with. But saying, you know, why don't you have a kid at this age or whatever, like even me being a mom, it's just like, I'm a mom and I had a child at an appropriate age, but it's still hard work, you know? But it's one of those things,
It's very tough.
It's not easy. It's rewarding. It is rewarding.
Yes.
And you learn a lot about yourself as a human being.
But I still think what a lot of people, like there's no rule book and there's no book to being a parent. But at the same time, a lot of us need to come to a place of healing, because I posted something on my story because I watch a lot of podcasts. 19 Keys is one of the people I watch a lot. right? And he had, I cannot remember her name, but she was like a healer. When she was on there, she was talking about the woman being the doctor of your household. So
Was it Queen Afua?
Queen Afua, that is who she is.
Yeah.
She was talking about being the head of your household by being the doctor in your household, where now all the healing is happening in the home. You know, so you're preventing your household from going to the doctor to figure out these illnesses that they have, because everything, you're healing them through your food, you're healing them through the medicines, the natural medicines that you're providing in your home. And a lot of people, I would say, not only women, but a lot of people are not educated on these things. You're not educated at something as simple as self-care. Little young girls are not learning the proper self-care growing up, because you didn't learn, you don't know proper self-care growing up, so you don't know how to teach them how to get rid of body odor, how to take care of their own hair, their skin. So stuff like that, I feel like you need to learn before consider being a parent. I know it happens unexpectedly a lot of times, but even if it does happen unexpectedly, you still go seek out the information on how to try to get it as right as possible, especially for the people that didn't have a good childhood because their parents didn't do it the right way. Now it's your responsibility to go figure it out. So,
we got to have an episode on parenthood. This conversation can go. But you're going to close them out?
Okay, so I want to thank you, Dr. Craig James.
No problem. Thank you guys for having me.
No problem.
Everybody, make sure you go find him, follow him, go to the office, support him. Let him know we sent you too. Okay. And this is another episode. We have come to the end of another episode of the Student to Life podcast, where learning and unlearning has no limits. Don't forget, like, share, subscribe, send it to a friend. It's a clean, educational podcast. You can have your kids watch it. So, like I said, share, like, subscribe, follow us, and we'll see you again next time. Another episode.
Bye, guys.
See you guys.